right. Hello, everybody. Welcome. It's really good to see everybody here tonight. We would love for you to turn your camera on if you would like to do so, but it's obviously not necessary. We just love to see your faces if you're where you can. So I want to introduce myself. I'm Eileen Thrower, and I am currently the clinical director at Frontier Nursing University for the Midwifery and Women's Health programs. And I'm also the interim associate department chair. And I'm going to let my colleague that's with me introduce herself, Stephanie.
Good evening or morning, depending on where you're at. I'm Stephanie Boyd, and I am the Director of Clinical Outreach and Placement Services here at Frontier, and we're happy to have you. And I believe we also have Karen on the call. Karen, you want to introduce yourself?
Hi, I'm Karen Brumbach. I'm an admissions officer. So if you have any admissions related questions, I'll be happy to answer them.
All right, thank you, Stephanie and Karen. So our session tonight, we do have a presentation, but the session is going to be quite informal. So please feel free to ask a question as we go. If you want to turn on your microphone and just ask the question, that's fine. Or if you want to put it in the chat box, that's fine too. And then we'll certainly take some questions at the end. Okay. So very typically what would be happening tonight is that Dr. Tanya Nichols would be leading this session. She is the current department chair for Midwifery and Women's Health Department at Frontier. She is currently on an airplane, I believe, traveling for some continuing education, so she won't be with us this evening. But she's a very, if you are around Frontier much, you'll get to know her pretty quickly. So this picture is a picture of one of our favorite things to do at Frontier, and that is to circle up. We have this picture here along with our mission statement because I think it really does sort of capture the culture that we have at Frontier, that we very intentionally have worked to create, which is a real culture of caring. And you can see that our mission statement is there on the screen. We really are working to provide accessible education for midwives and nurse practitioners. We want to prepare competent, entrepreneurial, ethical, and compassionate leaders. And of course, our focus is always on rural and underserved populations. That's where we are really focus our attention because we know the need that exists there. So you may know a good bit about Frontier, and you may not know as much. So I'm just going to kind of try to give a lot of basic information so that you'll have all the information that you may need. So, you know, all of Frontier's programs, we have nurse midwifery, women's health nurse practitioner, family nurse practitioner, psych mental health nurse practitioner. All of our programs are distance education. We have a campus in Kentucky, but all of our learning takes place online. So the wonderful thing about that, in my opinion, and I think we all agree at Frontier, is it allows you to stay at home in your community. And for most of our students are working to some degree. It allows you to stay there in your community, and that is really your classroom. It doesn't require you to move to Kentucky. You do end up having the wonderful opportunity to travel to Kentucky twice during our programs. Once is at the beginning for an orientation session that we refer to as Frontier Bound. And then the other one is a clinical skills intensive that takes place once you've completed all of your classroom work, again, classroom being at your home, but then that clinical skills intensive that we call Clinical Bound takes place as you're beginning to transition into doing your clinical practicum. And we're going to talk about that a little bit more in a minute. But I will tell you that, so what I think we find is it really is a wonderful model where you get to be at home and do most of your learning from the comfort of your own home, with your family, you know, taking care of all the other things that we have in our lives, like Karen's little one there. Hi there. But also you have a couple of opportunities to come to campus and really get to know your peers, get to know some of your faculty, get to know some of the staff that you work with, which really ends up creating this amazing community that I hear over and over again is for many people, they experience a sense of community stronger at Frontier than they have in brick and mortar institutions, which is really quite remarkable, considering that we live all over the country, certainly, and even all over the world to some extent. So tonight we're going to talk about, those of you that are here, I'm assuming are thinking about either pursuing a career in nurse midwifery or somewhere in women's health. And it is a beautiful thing when a career and a passion come together. And what I find is that for many people that are thinking about this, we're kind of like-minded and already have quite a passion for women's health care and improving outcomes and disparities and those sorts of things. So if you feel like that's describing you, you're in the right place right now to talk a little bit more about what we do at Frontier. So Frontier has a very large and diverse faculty. We have a faculty that represents an enormous amount of clinical experience and an enormous amount of education experience. We have students in each of the 50 states. We have alumni in every state. We also have alumni in many places around the world. We don't currently enroll international students, but many of our alumni end up taking their degrees and their certifications and going around the world and applying those skills outside of this country. We currently have about 2,500 enrolled students, and that's across all of our programs, all of the curriculum, and over 8,000 graduates at this current time. So it's a really big program. I'd like to say it really kind of operates like a well-oiled machine. But another thing that I just want to say again, even though it is a large program, we have a large number of applicants each term and a large number are accepted. There is really this amazing sense of community that is built, and we're all very intentional at Frontier about making it creating a real sense of community and a sense of social presence so that you don't feel like you're just sitting at home alone in this. You're really in this with a big team of people and a group of people surrounding you. I think that's really important, as I think we probably would all agree with this. Most of you here obviously are already nurses, and so you know that it's really helpful to rely on our peers as we move forward with careers that can be kind of challenging in healthcare. So I'm going to talk for just a minute about this group of people, this team that we've put together that we feel like really does provide amazing support for our students. So it's going to start at the very beginning with an academic advisor and a clinical advisor that are with you from the very beginning of the time that our students enter the curriculum, and they work with those advisors throughout. We also have a regional clinical faculty that our regional clinical faculty live all over the country, and they work with our students when they are in their clinical sites doing their clinical experience, and their regional clinical faculty, because it's really important to us that they're nearby. They may not be in the state where the students are, but they typically are in either the same state or an adjoining one. So very much aware of what's going on in the region, which ends up being really helpful. They get to know the preceptors that our students work with. They really try to form relationships with them so that they can give you a lot of guidance and support as students are searching for trying to identify a clinical site, working to find a place to do their clinicals, and also as they're in the clinical site. We also have a lot of we have a lot of mentoring groups, student groups. Our students are amazingly well connected. As you all know, we've all sort of experienced this in the last year and a half, because all of us have sort of been in our homes and trying really hard to stay connected with other humans. But this is something that Frontier's actually been doing for a long time, is building these support groups so that our students feel connected and supported. We have a very robust financial aid office. We have a lot of scholarships. In fact, I don't know if Stephanie or Karen could help me out. We heard these numbers earlier this week, really pretty astounding. Over $250,000 of scholarships that have been awarded this year already to our students. I can't say a number off the top of my head, but it was a large number of scholarships that are regularly distributed. We have a library at Frontier, but it's online. When you're on campus, we have a library. And if you saw that library, you would be a little underwhelmed. But when you look at the library resources that are available virtually on our online platform, you can get your hands on just about anything that you need, including many electronic textbooks. We also have a really active and robust diversity impact program. We have an Office of Diversity and Inclusion, and we have a Chief Diversity and Inclusion Officer. This is something that's really important to us and very high on our. It's really at the front of everything that we do at Frontier, because we know and understand the disparities in healthcare outcomes that all of our students are going to be working to address, but we also know disparities that take place across the board for people depending on some of their characteristics. So we really try to be very aware of that, and it's a big initiative of ours. So as you're thinking about applying for graduate school or any other major thing that you do in your life, this is kind of the top picture is kind of what we think or hope it's going to look like. And we all know the bottom is really more what happens, because the universe has things planned for us that we don't see coming, like COVID pandemic. But also sometimes it's much less, sometimes people decide to get married or have babies, and those things can make it challenging to move forward with your plans. But again, I want to just say that that student body that I mentioned earlier, 2,500 students, they're all adult learners. So they're all students that have families, jobs, lives. So we're really well versed in really trying to help support students as they work through some of those ups and downs that life throws at us. So if you're here thinking about degree options, let's talk about what Frontier has to offer. So obviously the majority of our students are in one of our master's programs, Masters of Science in Nursing, but we also have available a postgraduate certificate, and this would be well suited for somebody who's already a nurse practitioner, whether that's an FNP or a WHMP, adult gero nurse practitioner. We have postgraduate certificates so that you can add another specialty. And then we also have a Doctor of Nursing Practice program. So you can achieve direct admission. If you do an MSN program, then you can have a seamless admission and go on to the DNP program, or you can stop out with MSN. But we also have you can also apply if you already have a master's degree for just the DNP program. So the way our academic calendar works at Frontier is that we work on a term system. So we have 4 terms a year. Each one is 11 weeks, and then there's a 2-week break between terms. Okay, so using that kind of a curriculum setup, if you're going to get an MSN at Frontier, it typically takes between 2 to 3 years. If you're a postgraduate student, of course, that doesn't take quite as long. It's usually a year or a year and a half. And then the DNP program is usually something that is done in about a year and a half for those once you've completed that master's degree. So that would add a year and a half to the MSN timeframe. That makes sense. And I think there are probably some questions going on in the chat. So I don't know if Stephanie and Karen are already fielding those. If not, we will look at those when we're done. So no worries, we'll get to that. Okay. So again, just a little inspirational quote. I know that all of us have been faced with a lot of challenges over the last year and a half, but I'm really excited to see that you're all here thinking about what's the next step for you and moving forward. So when you're thinking about applying for Frontier, these are some things that you would want to know about admissions criteria. So you would already have to be a registered nurse with an active license. You've got to have a bachelor's degree in some field. You've got to have at least a 3.0 cumulative GPA from in your highest nursing degree that you earned. And you need to be in good academic standing in your prior educational programs. And this is a really important one. You have to have 1 year of nursing experience, but it doesn't have to be labor and delivery. It just has to be nursing experience. That's for the MSN program. For the postgraduate certificate programs, you would need to be an RN again. You'd already have to have a master's degree or higher. Some of our PGC students have a doctoral degree already. Again, a 3.0 GPA. And these are the specialties that you could already have that you might come to Frontier with to seek a postgraduate certification in another field like midwifery or one of the other programs. And what I love, one thing that I love whenever we have new students coming into, especially at Frontier Bound, I hear this all the time. We have small groups where we get to know each other, and it doesn't take long to be in one of those small groups to realize that you're surrounded by people who are here for the same reason, have a lot of the same passions. And oftentimes I hear the words, a student will say, wow, I have found my people. And it's a fun, it's fun for me to watch, and I know it's really great to experience. All right, so some deadlines that you might want to know about if you're thinking about applying. July 21st is the deadline to apply for the curriculum that would start in the winter, that would start in January 3rd. Now, obviously, that's coming up very soon in less than a week. If you apply by October the 20th, that would be to start for our spring term, which would start April the 4th. In order to apply, it's a fairly straightforward process. There's an online application. It does require writing some essays about your mission, what you're hoping to achieve with this degree, time management, some things like that. You need to include your resume. You do have to have references from professional colleagues. You would have to have transcripts from your prior educational programs, and then a portfolio for non-BSNs. Stephanie, can you speak to that? Was that for the Bridge program?
I'm sorry, can you repeat the question about the portfolios? I may be able to answer that.
The portfolio for non-BSNs was that?
Right, yes. If they have their ADN, but a bachelor's in another area, as long as their ADN is from an accredited institution and they meet that minimum of a 3.0 GPA, they would be eligible to apply through the portfolio option where you submit like a portfolio of requested information.
Okay, thank you.
You're welcome.
That makes sense to everybody, I hope. Okay, so you may be wondering about tuition. You can see on the slide the current tuition, the credit per credit hour, and then you can look at the website for updates on that. If you decide not to apply right now and you decide to apply in a year from now, you might want to check back to see what that current rate is. So the way the curriculum works at Frontier is that you do all of your what we call didactic work first. That means all of your like classroom learning, even though, again, as I said, your classroom is basically where you're sitting right now. All of your textbook learning takes place first, and then you do your clinical experience. Those clinical experiences include 675 hours in a clinical setting for MSN students. That is done in a minimum of 16 weeks, but typically takes more like 6 months. I would really suggest thinking of it more of a 6-month experience as a more realistic length of time. For our postgraduate students that already have a degree or that are already advanced practice nurses, they have a little bit less clinical hour requirement. So that number is 540 for them, and that has to be done and can't be done any faster than in 14 weeks. The DNP program requires 360 clinical hours. So it does again require a clinical site.
Dr. Thrower?
Yes, Stephanie.
This is Stephanie. Can I ask, there's a question that a couple people have in the chat that I would like for us to address out loud.
Great, thanks.
So about the application or the admissions requirements for the 1 year of RN experience, there are several people that are asking if their volunteer experience working with a lay midwife or their experience as a doula would count as part of their experience. And so I know the answer to that question is a little nuanced, but I'm happy to address it, or if you would like to do that, it might be helpful.
Go ahead, Stephanie, and then I can add anything that I may want to add if I need
Sure.
to.
Okay, please correct me if I'm wrong, but we do, I know there was another question to ask about the percentage or how many people apply, and Karen did address that in terms of how many applications we accept overall. So we encourage people who apply to be as competitive as they can be on their application. So if you don't have 1 year of RN experience, but you say had to have some time as a doula or have assisted with a lay midwife, you would certainly want to put that on your application because it does speak to your work in women's health, but it wouldn't count towards that 1 year of RN experience. So you may not be as competitive in your application as some who say had that 1 year or more of RN experience, but also I worked as a doula, et cetera. So that experience doesn't really substitute for the 1 year working as an RN. And Dr. Thrower may be able to explain that a little bit better, but we really do encourage you to be as competitive as possible when you're submitting your application.
Yes, thank you, Stephanie. The only thing I would add to that is that when you fill out your application, it is actually going to give you the opportunity to list every kind of certification that you have. And those things really do play into the admissions application. So if you have already the IBCLC, if you are a certified doula, those things are certainly there's a place to list all of that, and it really does make a difference. So,
and I would like to add too, if you do not have that 1 year of RN experience, which the admissions committee is very intent on people having, you can submit an additional essay explaining why you feel your years of doula experience should suffice for that 1 year requirement. However, I've seen the admissions committee defer your application without that 1 year of RN experience. That generally happens, but if you feel very adamant, you can submit an additional essay explaining that to the admissions committee for review.
Can I ask a question to add on to that?
please.
So I see that the application process begins about 5 months prior to being admitted into the program. Can you have started into that year, have a position as an RN, and it will be a year by the time that you would be admitted, but it's not a year yet? Does that count? Does that question?
It should be, you should have that RN experience 1 year prior to the start of coursework. So if it's not quite there, as long as you hit it by the coursework, it should be sufficient.
Okay, good. So I could go ahead and apply knowing that I would have a year if I'm admitted by the time I start.
Right.
Okay. Thank you.
Yes, and honestly, so for instance, if you were all ready to hit submit on your application, so you're trying to get started in January, and you started working as an RN this past January or this past December, you're going to hit that mark before then, and so you would be fine.
Okay.
If you aren't going to hit that 12-month mark before that time that you would start in the program, like Karen said, you can explain the reason that you're applying, but I think that it is it's a somewhat competitive process to get in. And I think it may be beneficial if you're within a few months to wait one cycle and apply for the next. Since we admit students 4 times a year, you don't have to wait a whole additional year. If you're going to be a month or two short, I would really encourage you to consider waiting and for the next admission cycle, so that you're going to hit that 12-month mark. I think you're going to be at a disadvantage if you don't have it. Well, I know you're going to be at a disadvantage. It's not to say that it couldn't happen, but you want to make yourself as competitive as possible.
Thank you.
You're welcome. Thank you, Rebecca. All right, so our little cartoon, you learn, you read, you learn, take it all in, and then you go to apply it, which is basically kind of how the process works at Frontier. So here's some pictures of some of the support team that you would have around you at Frontier. You've got, as I said, oh wow, we have Tanya Nicholson and Lisa Chappell. Those names got morphed into one person, but that's really two people. Lisa Chappell is the director of our family nursing department. I am the clinical director for Midwifery and Women's Health. You have course coordinators and course faculty, the regional clinical faculty that I mentioned before, your academic advisor, your clinical advisor, your financial aid officer, and a credentialing coordinator. Let me tell you really quickly that credentialing coordinator is the person that helps do all the legal things that have to be done for you to complete your clinical practicum at a clinical site. So it's a wonderful thing to have, because you're not chasing down contracts, somebody's doing that for you. So if you're here thinking that you want to become a midwife, of course, it warms my heart. I am a nurse midwife. I've been a nurse midwife for 30 years, even though I like to say I was a midwife. I used to say I became a midwife when I was 9. Now I've backed it down to 4. So one of these days I'm going to have to stop with that nonsense and just embrace it. But it is a challenging profession. It's, as you may, the most obvious thing that may be coming to your mind is the hours. Of course, the hours can be really challenging because babies like to make these grand entrances in the middle of the night. But I think that, like most things in life, part of the reason it's so satisfying and rewarding is that it is because of some of the challenges. I will tell you that I think Karen and Stephanie would both agree with me when I say that I am amazed on a daily basis by the resilience of our students. We've all been stressed and asked to develop resilience over the last 1.5 years with this pandemic. But I will tell you that outside of that, it is amazing what our students are able to adapt to and move forward with, and ultimately be successful. It's always it's a rewarding place for us to work because of that. So you may also know that we have recently opened a new, well, I used the wrong verb there. We've had a new campus for quite a while, and we are hoping and planning to have a grand opening is scheduled now for October, for the fall. And these are some pictures of our new campus, which is in Versailles, Kentucky. It is going to be a beautiful campus. It was originally, or it was last, a children's home, but it has been really updated and revised, retaining some of the beauty of the historical buildings, but also has been updated to become very comfortable. And so we're all really excited about getting to the new campus and just preparing on a daily basis for that. So questions about life as a midwife or a student midwife, or questions about being partners of a midwife? We're going to take those in a minute. I'm going to and we're going to take admissions questions. I think I'm going to stop sharing so we can anything else on these slides we need to look at before we talk about questions? No. Oh, here's some dates. We already said the winter deadline next week is the deadline for admission. There's a bunch of, if you go to the website, you're going to see all of this, but there are some financial aid at frontier.edu is a good email address to have. Clinical advising at frontier.edu is a good email address to have. Okay, let me stop sharing so I can see the questions in the chat box. Stephanie and Karen, I know y'all have been looking at it. Where are we and what do we need to talk about here? I can start right here. What are requirements regarding the COVID vaccine? Rebecca, great question. I'm going to be fully transparent with you when I answer this. This summer in August, we are having a pilot session, our first pilot session of students on campus. It's a very small number of students, less than 30. We have the capacity to have about 4 times that on campus at one time. So this is a very small number of students that are going to be there, sort of piloting the new campus, piloting our processes. And those students this summer are required to have the COVID vaccine. We do not have a policy in place for the fall when we have a full opening. Right now, there is no requirement for our students to have the COVID vaccine. However, let me rephrase that. Frontier Nursing University does not have a requirement that you have a COVID vaccine. But I'm going to tell you that many of our clinical sites are requiring our students to have a COVID vaccine in order to come there to complete their clinical practicum. So I would anticipate that if there's, I would anticipate in order to complete your clinical hours that it may be required. It's becoming very challenging to find a clinical site that would allow you to be there without the vaccine.
I accidentally replied, I think, to an individual as opposed to everyone, but in the admissions office, we're told that we're currently adhering to the CDC guidelines for the COVID vaccine and will continue to do so.
Yes, and that is typically that is our approach. But I do have to speak from clinical sites because clinical sites tend to say that they want their healthcare providers to be vaccinated. And I'm going to be fully transparent with you and tell you can't get through this program if you can't be at a clinical site. And so I'm just going to throw that out there.
Dr. Throw, to tap onto that, if you would want to talk about what type of settings as a midwife that students might experience either in clinical or as a certified nurse midwife,
Yes.
Because I know sometimes there's a little bit of, there are questions about the differences between the types of midwives. So we focus on nurse midwifery. Maybe you can talk about that a little.
Yes, thank you, Stephanie. Of course, some of you may know, or some of you may just be confused about midwifery in this country because it is very confusing. Most midwives in this country are certified nurse midwives, and that means that we are nurses first, and then we add midwifery. And at this point, the master's degree is required to become a certified nurse midwife, and that's what the Frontier program does. Other paths to becoming a midwife in this country, there are a few programs where you can become a certified midwife. I know Yale and Penn. You don't become a nurse first. You just become a certified midwife. So in other words, you take the same certification boards that certified nurse midwives take, but you don't have to have that RN license. However, those are fairly limited, and there's only a handful of states where those people can practice. The other then routes are certified professional midwives, and those are not nurses, and they also are not getting master's degrees. They're completing midwifery education programs that are certified by the North American Registry of Midwives, which is what we sometimes call direct entry midwifery. So they're not nurses first, and but they become midwives. Those certified professional midwives frequently practice in home birth settings. So let me talk very specifically about what we do as nurse midwives. So settings that nurse midwives work in include outpatient setting clinics where it may be a clinic that the midwife themselves owns. It might be a clinic owned by an OBGYN. It might be a clinic owned by a larger healthcare organization. But a lot of midwives, let me rephrase that. Almost all midwives spend most of their time doing outpatient care. Because many of us, as we become midwives, what we're thinking about is catching babies, but catching babies only lasts a minute. It's all that prenatal care. It's the care of the woman across the lifespan, and all of that is going on in the office setting. So nurse midwives also certainly do, most nurse midwives attend births in the hospital in this country. However, nurse midwives also attend births in birth centers and in home birth practices. Nurse midwives also end up doing things like teaching other midwives or teaching nursing students or teaching medical students, all of those things, because nurse midwives are arguably one of the experts at normal birth that we have in our country. I don't know if anybody has specific questions about that, or if that was a clear enough answer. We could talk about the different types of midwives for a long time, so I don't want to go too far down that rabbit hole.
Can you talk to them a little bit about what our faculty look like? Are they active in nursing practice, or are they involved in research, or what does that look like?
Okay, that's a great question. Thank you. Our faculty are all able to, and actually kind of encouraged to, continue clinical practice. So like for instance, I'll use me as an example. I do work clinically. What I do at this point is I volunteer 1 day a month at a free clinic. I do a women's health clinic 1 day a month. Although many of our faculty continue to practice as much as 1 day a week. So, and then we have some faculty that are not practicing anymore, but I think most of us try to maintain some clinical practice. We also, Frontier really encourages nursing scholarship, and we are involved in research and other types of scholarship. But I want to make this really clear. I'll be really, again, let me tell you my story in a nutshell. I did my midwifery at Emory. I have so I got my master's degree at Emory, and I have a PhD in nursing from another university. I don't have any degrees from Frontier. I ended up in Frontier because I love teaching. I love education. What I really have for many years known that I was being really called to do was teach, to make more midwives. So as I began to get ready, as I graduated, when I finished my doctoral program, I started thinking about where I wanted to teach, and I looked at the mission and philosophy of different universities. And it didn't take me long to know that I was really being drawn to come to Frontier, because, and this, so I'm circling back to this question about research. While Frontier really does encourage faculty scholarship and faculty research, our focus is always on education and teaching students. And that's a little bit different from institutions like Emory, where I did my midwifery, which is it's research intensive, and they have an enormous focus on research. Please don't misunderstand me. I think nursing research is critical, but our mission at Frontier is really teaching and educating nurse practitioners and nurse midwives. So that's really our focus. Okay, so Brittany, you'll be finished with your BSN in December. Will I have to wait until the fall to start? You would really want to then wait until...
She will want to wait until she would be eligible. I'm sorry. I'm
Karen,
juggling.
please help me out.
That's okay. I'm juggling the chat. You, my child. Sorry, it's kind of overwhelmed here. So you could technically apply for summer if you've got that 1 year experience, because the deadline for the summer is, I just had it pulled up here, will be January 19th, 2022. So if you will have a completed transcript in your 1 year of nursing experience, you could technically apply for summer.
All right, thank you so much, Karen. Please, you feel free to answer all questions of that nature. Okay, Deanna, thank you for this question. This is a really good one. Can I speak to nurses who don't work in labor and delivery or postpartum and what to expect during the transition to midwifery? Please let me say very clearly that labor and delivery experience is not required. Postpartum experience is not required. No women's health experience is required. But in addition to that, not only is it not required, it just isn't necessary. It's a different path. If you're becoming a midwife with 25 years of labor and delivery RN experience, or if you're becoming a midwife with no labor and delivery experience, it's a different learning path. But it doesn't necessarily mean it's a more difficult learning path. It is just different. And when I say that, I'll tell you that really what I mean by that is, for many of our labor and delivery nurses who have been in labor and delivery for labor and delivery for many years, a lot of their role transition is unlearning some of the things that they have been seeing being done that really aren't evidence-based and aren't best practice. And I know if I have any longtime labor and delivery nurses on the call, you'll know exactly what I'm talking about. We really do try to offer everything that you need, whether you have labor and delivery experience or not. I think you're going to find that when you get through all of your coursework, then you come to campus for that 1 week of that clinical skills intensive that I mentioned before called Clinical Bound. We spend an awful lot of time really focusing on the skills that you're going to need to go and get started. So the program really works, and it really works well whether you have labor and delivery experience or not. So I really want to try to put your minds at ease about that. I know that that is kind of anxiety producing for people who are considering applying for the program without that labor and delivery experience. But I also know when you don't have labor and delivery experience, it can be really challenging to get a job in labor and delivery. And so sometimes people just end up here, not because they haven't tried, but just because they haven't been able to do that. Yvette, is there a religious and or medical exemption regarding the COVID-19 vaccine for Frontier? Again, we're not requiring it at this point in time. We're following CDC guidelines. But I do want to, I feel like I would be doing you a disservice if I did not tell you that there are many clinical sites that will not allow students to come without the COVID vaccine. And the only exception that they are going to allow is a medical exception that says you have the risk of anaphylactic shock if you take the vaccine. Now, that certainly is not every clinical site, and so it may be that you would just need to find a different clinical site, but it's a little hard for me to, you all know that this is an evolving situation, and so the answer that I give you today would probably be different from an answer that I would have given you a month ago or a month from now. Our guideline is the CDC, and we are following CDC recommendations. Each term, we review the CDC guidelines and we update our COVID policy that's in place. And so that's really the best answer I can give at this moment. I don't know if that answered your question, but that's really the best answer I think that I can give. Rebecca, I thank you again. This is another great question. Can you speak to the preparation for a home birth or hospital birth? First of all, please know that Frontier is really committed to, we really are supportive of community birth. So we really think we'd love for our students to have birth center and or home birth experience. However, we also acknowledge that the majority of nurse midwives in this country work in hospital settings. And so hospital birth experience is required for every student. Not your whole clinical time doesn't have to be in a hospital, but you have to have some clinical time in the hospital. There is not a requirement for out of hospital birth, but we do encourage it. And if you have interest in out of hospital birth, we really love for you to try to pursue the opportunities to be in out of hospital birth settings.
Dr. Thrower, there's a question about support for clinical sites and how do students find clinical sites? And there's a question about types of clinical sites. Do you want to talk about that, or would you like me to talk about that?
Go ahead and take it, and then I'll add to it if I want to.
Perfect. Okay, so as Dr. Thrower has explained, we have quite a large support system for our students, but there's always the question is how do we go about finding our clinical sites and preceptors. So for our students, there's always been a tradition of the student is identifying their clinical site and their preceptor, and it speaks to Dr. Thrower's introduction, which talked about how individual your program of study can be at Frontier. So we do allow students to search for their own clinical sites and their own preceptors, because oftentimes, and what I think is great about our nurse midwifery program, although I'm a little biased, is that you can have experience in hospital and out of hospital to be able to really, we're talking about birth centers and all those kinds of out of hospital birth experience. So there are some parameters around all of that, and you'll learn about those parameters when you do come to Frontier Bound at orientation. That being said, the day that you walk in the door as your first day of enrollment, you have access to a group of clinical advisors and your RCF, and we work to help you construct your clinical plan. And that starts the very first day that you walk in the door. Some students will already know, I want to work at X, Y, and Z hospital. I want to be at this birth center to get my births. And we start right away on constructing that plan. Some students aren't really sure where to start, and we also work with those students. We have lots of resources to be able to support you in your search, including a clinical site database that has well over 15,000 clinical sites that Frontier has had a previous relationship with or has a relationship with currently, and students are able to really dig into that database to find potential sites and preceptors if you're not sure where to start. So it's very individual depending on the student, but we have staff and faculty that help walk you through that site identification process. And then once you're ready to say, these are the sites and the preceptors I would like to work with, we have a group of clinical credentialing coordinators that work on securing the contract if it's not already secured, and then credentialing your site and your preceptor. So the student does the work on the beginning to help decide what sites and preceptors they want to work with, because you can have more than one site and more than one preceptor. And then we help put all those pieces together to make your clinical plan. So we don't place students in site per se, which is also the great part. We do hear students say, you know, will you just put me somewhere? And we don't necessarily do that because we want you to have that flexibility to be able to choose where you're going to rotate at. But we certainly work with you to get you the most individualized plan and have it look what you want it to look like for your future as a practitioner. So that's kind of summarizes it. It's much more detailed than that once you get in to the program, but we do have lots of support in place to be able to help you with clinical site identification.
All right, so let me answer a couple. Thank you, Stephanie. Perfect. So let me answer a couple other things. So Stephanie, if you don't get everything in on time for the July 12th deadline, it's just going to roll into the next application cycle. Is that correct, Karen, or no?
Yeah, sorry, that for admissions. Okay, so to cover that, basically, if you miss the deadline, if you do not get everything in for the deadline, you'll want to contact your admissions officer. Yelena Drisick has A through D. I myself have E through K. Susan Williams has L through Q, I believe, and Katie Moses has R through Z. And you'll want to reach out to them individually. If you can have a courtesy deferral one time. So if you have applied for winter and you're not going to make it in, we can defer your application to spring. You will not have to pay again. However, if you have deferred in the past, if you applied for fall and you deferred to winter and you still didn't get everything in, you'll have to reapply. So you'll want to just double check with your admissions officer for that. But yes, the deadline for winter is July the 21st, and then the spring cycle will open July the 22nd.
All right, thank you, Karen. All right, Anastasia, if you don't have labor and delivery experience, the question is, would I suggest taking birth assistant courses to learn some skills? I think anything that you take of that nature would be helpful, and some of it, if it results in some kind of certification, that's actually probably really applicable for the application itself. Even if it doesn't, I think that's still something that you would include in an essay. So yes, I do. I would really recommend you taking advantage of any kind of opportunity for anything like that. Another question that I wanted to answer, Ida, it looks like you're asking, or Ada, I'm sorry if I'm saying your name. Oh, I'm sorry. If you already have an MSN and RN experience, if you have an MSN in something like nursing education or nursing administration or something of that nature, in order to become a nurse midwife or a nurse practitioner, you would actually again enroll in our MSN program. You have to have an MSN as an advanced practice nurse in order to do a postgraduate certificate program. Does that answer your question? I hope. So, and all of our students that are applying for the MSN are basically applying for the MSN, well, or maybe I should let Karen speak to this. the way you can sort of, it's really kind of a one application for the MSN and DNP more or less, but you don't have to continue
Yes,
to complete the DNP. Is that an accurate statement? Okay.
that is correct. You're not obligated to, and you don't have to know up front. If you want to wait and think about it, you'll get an email from IT like in your last semester or two asking you if you want to go straight through into your CDNP. If not, that's okay too.
Sarah, this is another good question. If you're thinking that you may have to move when you're in the program, would you be able to change clinical sites to reflect the state that you're moving to? Absolutely. That's no problem at all. We have students all the time, every day, that move, and we certainly work around that. So that's not an issue. Okay, Michelle, this is another really good question. Can you do clinicals at the hospital that you work at? I'm going to get straight to the answer. You cannot be a midwifery student in labor and delivery and be an RN on the same unit. So here's another way of saying it. You cannot, in one unit, you can't sometimes be there as an RN and sometimes as a student nurse midwife. So the same is true of postpartum. So because, right, if you're working postpartum, you may also be doing, if you're an RN on a postpartum unit, but you're doing your clinicals there, you would need to be a student nurse midwife there. So postpartum doesn't work either. But you could potentially stay in that institution. You're just going to have to transfer out of one of those units into, I mean, you could transfer to med surg, but if you're like me, if I had to work med surg, it would not be pretty. It would not be good. That's not what I do. I only do women's health. So I'd probably have to have found something a little bit different than that, but there are other options. You can actually work NICU, because as a nurse midwife, a patient in the NICU is never going to be your primary patient. Okay, so there are ways to work around it, but the short answer to your question, Michelle, is no, you cannot work on a unit and also and do your clinicals there. Allison, finding a clinical site can be challenging. It is more or less challenging depending on a lot of different variables. Certainly, the pandemic has made it challenging across the board for all of us. There was a time last summer where we very rapidly created a virtual clinical setting so that students could continue to get some clinical experience, because essentially all clinical sites closed to students. It's getting much better. Now, some of the limitations really focus more on where you live. You know, I'm going to tell you, for instance, if you live in the state of Mississippi, I think there are maybe 4 or 5 practicing midwives in that state, nurse midwives in that state. And so it can be challenging in that state to find a provider, a site. If you're in Georgia, we've got lots of nurse midwives and it's easier. So I'm going to tell you that students do travel for clinical sites, but again, it sort of depends on where you live and that sort of thing.
Yes, and just to tack on to that, it's very individual, as Dr. Thrower said, along with maybe a geographic restriction. There could be, depending on what the demand is in that area for clinical sites. You also have to think that it could take up to 6 months to credential a site, and some sites have waiting lists that are a year long or more right now. So that's why we get you thinking early and often about this, so that you can get all your ducks in a row and we can help you get everything set. I will tell you that the data doesn't support that our students are leaving because they can't secure a clinical site. So we have a very high matriculation rate and success rate, graduation rate. That is hard to say after 6 p.m. So, so don't be discouraged. I would say start early, start often, really start making relationships with people in your community. If that's where you want to do your clinical experience, start to learn where the nurse midwives are. I think that is something students don't always recognize. If you're in the midwifery program at Frontier, the majority of your hours have to be supervised by a certified nurse midwife, not a physician. You can do some hours with a physician. So you just want to know what is the climate in your community, who are the practicing nurse midwives, and where you can best find support, or what flexibility you have. Can you travel to another area where maybe there's not as much competition? Like Dr. Thoreau said, we do have students that do that. So we'd love to talk with you about that. And you all can email me directly if you just want to chat about, just questions or concerns you have.
Okay, let's see. I'm trying to see other questions that we've missed.
I have a question,
Okay, go ahead, Rebecca.
and it's also a question that's up here on the board that I share. And that is, can we expect to be able to work while we're working, especially on our didactics, and how many hours a week do we need to have free? How do we balance that?
Karen, are you just itching to answer that question or no?
All right, I'm sorry, what was the question?
She was talking about working and how many hours you could work.
I get that question, but I'm never overly comfortable answering it
okay.
because I don't have the nursing experience and because everybody's different.
Yeah, Stephanie?
I would love to answer that question because we get it all the time. So in a perfect world, you would not work. You would go to school full time and you would do your clinical rotation full time and get done in the crack of a whip. We all know that a lot of our students are working. And so what we tell students is to have a plan early. Talk with your academic advisor about your course load. There is some flexibility. The more that you work, the more challenging it can be because life is going to throw you things that you cannot plan for. Those things are stressors, whether they're good or bad, marriages, pregnancies, all types of things. So we try to plan with you so that it's not a stressor. However, once you get into your clinical rotation and experience, you will find that your clinical experience and your schedule is really dependent on when the clinical site and the preceptor can work with you. So you're working on their schedule many times, and that makes it difficult. And once you're in your clinical courses, you're required to work 20 to 30 hours in your clinical, just depending on what course you're in. So you have to take all of that into account. And when you're planning, there are some sample programs of study online. You can find them for a Part A or a Part B option that will show you what your variation in course credits per term can be. So that helps you plan a little, but we say try to financially be prepared so that if you had to back off of work, that you're not thinking about that the term before you have to make all of those decisions. So that's the best answer we can give you. I mean, and ideally, if you don't have to work, that's great, but how many of our are financially independently wealthy? Probably not many.
Yeah, the only thing thank you, Stephanie. The only thing I would add to that, Rebecca, is that I would say most of our students work during their didactic courses and clinical. However, I would also say that it is the rare student that can work full-time through the whole program and be really successful. I think, I'm not saying it can't be done, but it is quite challenging. If you have to work full-time, it can be quite challenging. The best thing that I would say is start saving up PTO so that you have some in your pocket. Just like Stephanie was saying, there are going to be times particularly in that clinical, during your clinical practicum, that you, well, let me put it this way, at the very end, you're expected to do some hours where you're working at least a minimum of 30 hours a week in the clinic. So that's almost a full-time job right there. And if I hear somebody's doing that, plus working full-time, plus starting to already begin to study and prepare to take the boards exam, it's very challenging. So now nurses can have really flexible scheduling, right? Because you could work a full-time job potentially Friday, Saturday, Sunday night, and then have Monday, Tuesday, Wednesday, Thursday to really devote to study. So it can be done, but I do think it's really wise to make some plans. When you're filling out that application, begin to be making plans about how you can accommodate some extra time that you're going to need for the time that's going to be required. All right, so there's a question about traveling for clinical placements and working full-time. Again, that really looks a lot of different ways. Travel for clinical placement sometimes just means I have to commute an hour and 15 minutes both ways. And I do that every day when I go to clinic. Or sometimes it means I'm going to a place that's 4 or 5 hours away. And so I can't do that every day, but maybe I can go Sunday to Thursday, and then I come home for a couple of days every week. Other people end up moving to a different state and just staying for 6 months and getting their clinicals done. So it really looks a lot of different ways. Sally said, so you are definitely not on campus for the 11 weeks ever. There are 2 times that you come to campus, and each time is no more than a week. The orientation session is not a full week, that's at the very beginning, and then that clinical bound session is a full week, and that happens about 2/3 of the way through the program. And then Sally, what we really hope is that your clinical placement is based on, hopefully, very near where you live. The nearer for you, the better. That's what we'd really love, is for you to be able to do this in your own community. All right.
I just typed that as you said that, Dr. Thrower. And I will also add, in terms of location for clinical sites, we have a policy that your clinical experience must be completed within the United States. So we often have students that will ask if they can do their clinicals in Africa, the UK, the Virgin Islands, and we say no to that. There's lots of reasons why we won't go into here, but I always wanted to make that clear, because it's something that students don't think to ask right up front, and we don't think to always say right up front. So,
and Stephanie, to add to that, I've also been told military sites, even though they're technically US, are not allowed. Correct.
That is correct.
You have to, your body would have to physically be in one of the 50 states for your clinicals. Victoria, I love the way you're thinking with this question. So Victoria says she's about to start her ADN. Should she plan to maintain her DONA, CLC, and Lamaze certifications? Yes, yes, and yes. All of those things are going to be very beneficial to you in the application process. And they're not as beneficial if they're not current. They're going to need to be current certifications, but those things really do, they really do help make your application more competitive and rigorous. Okay. Does anybody, so if you had a question in the chat that we missed, please just speak up and say so, or even potentially just type it again. All right. Thank you all for coming. It's really nice to be able to chat with you, and I'm very excited that you're interested. Sally, I love that you're certified in the Bradley method. I mean, obviously still know about it. It's still being done some places, and that's something that you want to put on your application. And Stephanie, did you put your email in there?
I think it's 2 messages up.
Oh, there it is. Yes. Yes. And same for me, Eileen.thrower@frontier.edu. You can see my name on the screen. So please feel free to reach out. If you sleep on this tonight, wake up tomorrow morning and you're thinking, oh my goodness, why didn't I not ask this question? Just feel free to reach back out to us. And Karen, thank you. Karen put her email in there also. I think that's me. If my fingers are still working at 7 p.m. All right, thank you everyone. We appreciate it so much. Any other last minute questions anybody has? All right, I'm going to stop the recording.